Imagine spending over 20,000 pounds a year to, actively fail at solving a problem. When succeeding, like actually fixing the root of the issue, only costs about 1,400 pounds.
Right. I mean, it sounds like a clerical error or a massive failure in basic accounting.
Yeah, exactly. It sounds totally absurd. But that is exactly what the UK government was doing with homelessness. And they certainly aren't alone in that kind of systemic inefficiency.
No, not at all.
So today we're taking a deep dive into the sources on how massive, structurally complex global problems, things like healthcare access, systemic poverty, or housing, how they actually get solved. And spoiler alert, it is not by throwing up a pitch deck slide that says, look at this trillion-dollar disaster, please care about it.
Right, but that is the traditional approach, though. Whenever someone...
Okay, let's unpack this, because we are exploring a framework today developed by global strategist Sophie Krantz, and it's called the crossover point. We are going to unpack how solving these massive issues requires completely abandoning that shock and awe approach and shifting away from philanthropic budgeting toward highly sustainable, defensible procurement.
It represents a radical shift in perspective. It moves the conversation from asking capital allocators to, care about a tragedy to presenting them with a highly rational mathematical decision.
Let's pause on that, because if you're listening to this and you run a startup or you work in venture capital, you might be thinking, wait, isn't the total addressable market the TAM the holy grail of every pitch deck?
Oh, absolutely.
Right. Founders are trained to obsess over TAM to prove their market is huge. Why does Krantz's framework argue that focusing on TAM is actually the wrong approach when it comes to structural global problems?
Well, it's because of the behavior that calculating TAM actually drives in this specific context. For a commercial software product, sure, a massive TAM implies unlimited financial upside.
Right.
But when you apply TAM to a global social crisis, when you calculate the millions of people affected by an unmet need, you aren't calculating a market opportunity. You are calculating a tragedy. And mathematically, you are producing a budget.
Wow. So you're basically pricing your solution for a charity.
Yes.
You're essentially saying, here is a massive deficit in the world. Please give us a grant to chip away at it. You are asking for a subsidy to manage an ongoing disaster.
Right.
But Krantz argues that if you actually want to solve the problem structurally, you should not be calculating the sheer size of the issue. You should be calculating the cost of a single verified unit of change.
Okay.
And then comparing that to what the system is currently paying to leave the problem completely unsolved.
And that changes the dynamic entirely, because if you're comparing the cost of solving to the cost of the status quo, you aren't asking for a philanthropic grant anymore. Exactly. You are producing a position. You are pricing your solution for a contract.
That brings us to the actual mechanics of Krantz's framework. Instead of looking at the whole mountain of a problem, we're looking at two specific intersecting lines. This is how we find the crossover point.
Yes, the crossover point is defined as the exact moment when solving a problem structurally becomes cheaper than leaving it unsolved.
Right.
And to find it, you track two curves moving in opposite directions. The first is the supply side curve.
Okay.
This represents your unit economics, the actual cost to deliver one verified outcome. And as technology improves, as you scale and optimize your operations, the marginal cost of that solution naturally drops.
And that supply side curve is falling.
Yeah.
Then we have the second curve, which is the demand side.
Correct.
And this represents what the system is currently paying while the problem stays unsolved. Because problems compound over time. And the institutional alternatives to fix them usually shrink, so that cost is constantly rising.
Yeah, exactly. And where those two lines intersect, where the falling cost of the solution crosses the rising cost of the status quo, that is your crossover point.
Okay.
Documenting that exact intersection is what makes a position entirely defensible to a government buyer or a serious global investor.
It makes you think about the financial shift from renting an apartment to getting a mortgage.
Oh, that's interesting.
Like when you rent, that's your status quo. You're paying every single month just to not be homeless. And because of inflation and rent hikes, that cost compounds over time. The curve is going up. But if you take out a mortgage over time as you build equity and pay down the principal, the marginal cost of that housing asset drops.
Right.
The exact month where your equity outpaces the dead money you were throwing at rent, that is your personal crossover point.
That is a brilliant way to conceptualize it. What's fascinating here is that with global problems, though, The rent, the cost of the status quo, is usually invisible.
Yeah.
Almost everyone focuses their energy entirely on analyzing the cost of the mortgage or the cost of the proposed solution. They scrutinize the overhead, the salaries, the operational efficiency of the organization pitching the idea.
Right, the new thing.
Exactly. But almost no one sits down to rigorously calculate the compounded hidden costs of all the ongoing damage of just doing nothing.
And why is that? Like, why is the cost of the status quo so easily ignored?
Because it's dispersed across the system. It isn't sitting neatly on one balance sheet. It's hidden in lost tax revenue, increased healthcare premiums, overloaded emergency services, decreased productivity. We are blind to the cost of failing because we accept it as a normal baseline.
Which takes us right back to that staggering math we opened with regarding homelessness in the UK. If the 14-to-1 ratio is so incredibly obvious, why wasn't the government already acting on it? Let's break down the research by Nicholas Pleas for Crisis UK.
Yeah, this case study perfectly illustrates how a system can be blind to its own demand-side curve. Pleas's research revealed that the annual public spending cost for a single person sleeping on the streets was £20,128.
What?
That is the cost of the status quo.
Okay, but wait, if we say the system is just managing the fallout, that sounds a bit dismissive of the charities and emergency services actually doing the work, right? How exactly is that £20,000 being spent?
It's a fair point. The people on the ground are working incredibly hard, but they are trapped in a reactive loop. That £20,000 isn't going toward a structural housing solution.
Right.
It's highly inefficient spending dispersed across the entire public sector.
Right.
It is emergency room visits for exposure or pneumonia. It's local police call-outs. It's processing through the legal and court systems. It's funding nightly beds and temporary makeshift shelters. The system is hemorrhaging cash just to keep someone barely surviving on the street, not to get them off of it.
And then the researchers looked at the supply side curve, the cost of a solution. The cost of early intervention to actually prevent that person from ending up on the street in the first place was calculated at just £1,426.
Yes.
What does that intervention actually look like in practice?
It involves highly targeted, pragmatic actions before the crisis fully hits. It might mean paying a month's rent arrears so an eviction never happens.
Wow.
Or it might involve funding legal mediation between a tenant and a landlord to resolve a dispute, or providing targeted mental health or employment support the moment someone loses their job.
So instead of waiting for the compounded disaster, you fix the localized leak, and that creates the 14-to-1 ratio. This means the money to solve the problem was already there in the system the entire time. It was just being deployed terribly.
Exactly. And the philosophical shift this creates is monumental. Once a government or an investor sees that 14-to-1 ratio, funding the solution is no longer a charitable act. You do not have to appeal to someone's moral compass or convince them to care about homelessness anymore.
You're just offering them a better deal.
It becomes a purely rational, sustainable procurement decision. You are showing them how to buy a verified outcome for drastically less money than they are already spending to fail.
That is so powerful.
It shifts the entire power dynamic from begging for a grant to offering a highly defensible contract.
That is a profound shift, but it does raise a massive operational question. A 14-to-1 ratio makes perfect sense on paper, but how does an organization actually build the architecture to deliver that verified unit of change at scale?
Right, that's the hard part.
It's one thing to say early intervention is cheaper. It's another entirely to deploy it reliably across millions of people.
And for the mechanics of that, the sources take us to community health in sub-Saharan Africa. This serves as a masterclass in transitioning from funding well-intentioned activities to actually buying verified outcomes.
Because historically, community health in that region was a classic example of what Krantz calls the hard power approach, right?
Yeah.
Large institutions, centralized infrastructure, massive multilateral budgets.
Yes, exactly.
But the early 2000s, child mortality in places like Uganda was still devastatingly high. What was fundamentally broken about that approach?
Well, the core issue was that health budgets were designed to fund activities completely disconnected from outcomes. They funded the construction of physical clinics, many of which were severely understaffed and routinely out of medicine.
Oh.
They funded vast networks of community volunteers who were trained once and then largely left unsupervised. The centralized hard power model simply could not reach the last mile of a rural community at a cost the system could sustain.
So they're paying for motion, but not necessarily progress. Enter an organization called Living Goods. They approached this structural gap with a completely different asset class. Here's where it gets really interesting. They swap the centralized hard power hospital model for a decentralized soft power model, running on community trust and local knowledge. And they operationalize it using what they call the DESC model.
Yes, DESC. It is the architectural framework that makes their unit economics verifiable. It stands for Digitally Enabled, Equipped, Supervised, and Compensated Community Health Workers.
Let's unpack that acronym, because jargon can sometimes hide the actual mechanics of a solution. What does digitally enabled look like for a health worker in a rural Ugandan village?
It means that a local woman who is already known and trusted by her neighbors is walking door to door with a smartphone, running specialized diagnostic software.
Okay.
She isn't guessing at symptoms based on an old training manual. She has a standardized digital triage tool right in her hand.
And equipped.
Equipped means she is carrying a physical supply of essential medicines in her bag. Antimalarials, antibiotics, rehydration salts. She isn't telling a mother to carry her sick toddler 10 miles to a clinic that might be locked or out of stock. She is treating the child on the spot.
That's huge. And what about the supervised and compensated part? Why is that a departure from the norm?
Historically, community health relied on the goodwill of volunteers. People burn out when they aren't paid, leading to massive attrition and inconsistent care. Living Goods health workers are digitally supervised, meaning the smartphone app tracks their visits, diagnoses, and follow-ups in real time.
Okay.
And because that data is tracked, they can be reliably compensated based on those verified health outcomes.
But soft power, this reliance on local relationships and community trust, it sounds a bit unscientific to a traditional capital allocator. How do you prove to a government buyer that a decentralized network of neighbors with smartphones actually reduces child mortality?
Well, you test it with the same rigorous standard you would apply to a new pharmaceutical drug. Living Goods didn't just point to theoretical models. They ran 2 gold standard randomized controlled trials, or RCPs, in Uganda to definitively prove their impact.
What did the scope of those trials look like? Because, a pilot program in a tightly controlled environment is very different from scaling across the whole country.
That is precisely why the timeline matters. The first trial in 2013 was tightly managed and showed massive improvements. But the true acid test was their 2021 trial. This wasn't a small sandbox.
Right.
It spanned 13 separate districts involving 500 villages and over 12,500 households.
And when you expand into the messy reality of 13 unmanaged districts, that's usually where social programs completely fall apart.
But the Living Goods result held steady. The RCT proved a 27 to 28% reduction in under 5 mortality.
Wow. And here's the vital unit economic that ties this all back to Krantz's framework. Full community health coverage under this model costs just $3.09 per person per year. $3.09.
It's incredible. If we connect this to the bigger picture, compare that verified outcome cost against decades of centralized institutional spending that routinely failed to move the needle.
It's undeniable math. You combine deeply earned soft power assets, the trust of the community, with hard verification data. You prove the $3.09 cost. And once that number is laid out next to the system's ongoing expensive failure, what happens?
It leads directly to systemic adoption. That undeniable unit economic is what allowed Living Goods to secure government contracts in Kenyan counties like Isiolo and Kisumu. The model successfully transitioned from being an externally funded philanthropic project entirely reliant on donations into a government-contracted public service.
Which is the dream for anyone tackling a structural problem. You don't have to keep passing the hat around for charity every year. You are a vendor providing a superior life-saving service.
Exactly.
So if you're listening to this and trying to build a solution in your own industry, how do you replicate that? Krantz's framework outlines a specific 4-question diagnostic test to run. Let's test the framework live. Let's pretend we're a startup trying to improve agricultural yields for smallholder farmers.
These 4 questions are the litmus test to determine if you have genuinely calculated your crossover point or if you're just selling a story.
Question 1. What is the single verifiable unit of change? Krantz is absolutely ruthless about this.
And for good reason. Without an outcome unit, you have nothing to anchor your pricing to. In your agriculture example, the unit cannot be something vague like empowering communities. It has to be highly specific. One farmer completing a full, digitally tracked input-to-market harvest cycle. If you cannot attach a cost to a single verifiable sentence, the framework argues you do not have a defensible market position. You just have a mission with activities.
You're just pointing at the mountain again.
Okay.
Question 2. Has the cost of solving dropped below the cost of leaving it unsolved, and can you prove it?
This requires putting the demand-side curve and the supply-side curve into the exact same sentence. You have to quantify the cost of the status quo in the case of the farmers, maybe it's lost export taxes, or government food subsidies required during poor harvests, and compare it directly to the cost of your digital harvest cycle. If your solution isn't materially cheaper than the status quo, you haven't hit the crossover point. You need a different operational model or a different entry point into the problem entirely.
Got it. Question 3. Are the barriers structural, or did they just belong to the institution that tried last? This brings us to a concept Krantz calls the choke point map. What exactly is a choke point map in practice?
Think of it as tracing the exact step-by-step journey of a solution, trying to reach the person who needs it, and marking every single place where the flow of value stops or slows down.
Okay.
A choke point could be a physical reality, like a lack of paved roads. It could be a corrupt local official demanding bribes. Or, crucially, it might just be an internal bureaucratic policy. The goal is to map where the friction is highest.
So if we map out the agricultural supply chain, we might find that the reason a massive global NGO failed to deliver fertilizer wasn't because the villages were physically unreachable. Maybe the choke point was that the NGO's internal policy required 6 levels of sign-off from headquarters in Europe for every micro-expenditure.
Exactly, which means the constraint exited the building the moment the NGO packed up and left.
Right.
That is an institutional barrier, not a structural one. Deploying your startup's resources to fight a ghost constraint that no longer exists is one of the most expensive mistakes you can make.
Yeah, that makes a lot of sense. And finally, question 4. This is known as the voltage test. Would the solution still work if you remove the founder or the grant? Now, I have to say, this is a really tough pill to swallow for a lot of visionaries.
Oh, absolutely.
Because if your model falls apart the moment you, the charismatic founder, step out of the room, you haven't actually calculated the crossover point. You've just calculated your own hustle. You've calculated the founder.
It challenges the ego directly. But it raises a vital point about systemic design versus charisma. Investors and government procurement officers are not looking to buy exceptional localized conditions. They're looking to buy a reliable machine.
Right.
Passing the voltage test, exactly like Living Goods did when they expanded their RCT into 13 unmanaged districts away from their core team, is the ultimate proof. It proves that the incentive structures and the verification mechanisms are embedded in the design itself, held together by the system, rather than relying on a heroic founding team to constantly intervene.
If you can answer all 4 of those questions with clean, verifiable numbers, Krantz says you have the foundation of a real defensible market position. The crossover point is behind you. But here is the ultimate payoff of this entire framework. Once you pass that 4-question test, something massive happens to the scale of your solution, completely transcends borders.
This is the outcome of the calculation that surprises people the most. When you verify that outcome unit and document your crossover point, your hard problem suddenly stops being a local anomaly. Global market scale becomes a mathematically calculable reality.
Because the math doesn't care about geography. The exact same verified low-cost unit economics for community healthcare that work in a county like Kisumu in Kenya will work in Kampala or Dhaka or Nairobi. Hard problems at this structural level are global by definition, which means the demand-side curve, the massive cost of the status quo, has a trajectory that doesn't respect national borders either.
But it is vital to remember exactly how you get permission to cross those borders. Capital alone cannot buy the soft power credibility required to scale.
Right.
A massive influx of venture capital from an investor in Silicon Valley cannot magically purchase community trust in a rural village or the deep operational knowledge earned by actually living inside the problem.
You can't just parachute in with a giant check and expect the system to bend to your will.
You absolutely cannot. But when you combine those deeply earned, localized soft power assets with a mathematically verified low-cost outcome unit, that is the alchemy. That is what turns a defensible market position into a global one.
Yeah.
It allows a model to scale across global markets because the procurement officer, whether they're sitting in London, Nairobi, or New York, is looking at the exact same undisputable math.
It's a complete paradigm shift. We move from staring helplessly at the massive scale of a problem, paralyzed by the TAM, to isolating a single, highly verifiable unit of change. We stop asking for philanthropic charity to buy more buckets for a leaky roof, and we start offering governments some mathematically sound, deeply practical contract to fix the roof once and for all.
It demands that we stop accepting inefficiency as a baseline, look closely at what the system is currently tolerating, and put a very hard, transparent price tag on that ongoing failure.
And that leads to a final thought for you listening to this deep dive right now. Think about your own industry, your daily workflows, or the biggest friction points in your own career. How much cost of the status quo is hiding in plain sight, completely uncalculated, simply because everyone around you assumes it's just the way things are done? If you actually sat down and ran the numbers on all those proverbial buckets your company or industry is buying every single week to catch the leaks, what would your own personal crossover point look like?